Ooh, I feel taller.
Oh my God.
That
Really?
was really loud. Welcome to the office. Hi, Nicole.
Hi.
Welcome to the office.
Thank you.
How can I help you?
So I've been having like TMJ problems.
What does that mean?
Like my jaw is like kind of misaligned, and it has been since like 2022 this summer.
Did you do something to it?
I had a car accident, but it was like very mild, but the airbag opened on my face. Well, I don't know if it opened on my face because I couldn't tell, because I was thinking about other things.
Everything was happening pretty fast.
But
this was
I'm very
2022.
short. Yeah, February 2022.
Okay, so
then
rear-ended or you rear-ended somebody?
Somebody rear-ended somebody, I rear-ended somebody, so it was 3 cars.
Got it, okay. And so when you went forward, airbag
Yeah.
deployed, you felt something hit your face?
I felt it hit me here, but I'm so sure that I'm pretty sure it had to have hit my face because that was in February. And then this summer, I started noticing that my jaw would move by itself.
Move how?
Just like,
Because it does move by itself.
yeah, like that.
So
but
you were
aggressively.
noticing more lateral movements.
Yeah.
It was shifting side to side.
Yeah.
You felt popping, clicking on the right or the left?
At that time, I didn't feel popping or clicking. Just I guess to the right, my teeth kind of felt off.
So you felt that the jaw was deviating, shifting to the right side?
Yeah.
Got it, okay.
And then I saw a chiropractor, because I moved temporarily to Colorado, and I saw a chiropractor out there.
What are you doing in Colorado?
Family reasons.
Okay.
Yeah.
Right.
And so she helped me a lot. It was getting better. And then this summer, it was like almost fully like healed, I would say. Like there weren't really any problems. And then I do kickboxing, so I got kicked in the face.
Of course you did.
And
of course you do.
Yeah.
Of course.
And then it triggered everything.
Who cares? I have a TMJ problem. I'm gonna go get kicked in the face.
Yeah.
Of course.
And yeah, well, we're not supposed to hit each other in the head in that class, so yeah, it was an accident. But so that happened, and then I think it kind of triggered it, and
You got kicked on the right or the left?
here on this side,
Left.
the left, yeah.
Okay.
And then I moved away, and so she recommended me to see you, but I didn't at first because I was dealing with moving in a lot of shows because I'm a singer.
Okay. What kind of music? What's your
like
genre?
pop rock usually.
All right.
But then that's when the problem came in because I started to notice that I couldn't like sing or even like talk sometimes because it would be like so strained here. Like there's a lot of tension.
Understood.
And yeah, there was like one time I was singing with my vocal coach and I came home and I felt like someone was like choking me because it was like so swollen, like everything just felt really bad. And I was like, I have to do
Do you have your
this.
tonsils?
I don't actually.
Okay. They were taken out when?
When I was 7.
Okay.
Yeah.
But did it feel like you had swollen tonsils? Like when did you remember it? Do you remember when you
I
thought-
don't remember
Okay.
when I was 7. Yeah.
No worries. Okay. All right. So that's our number one issue.
Yes.
Anything else?
I've been told that I know like the curvature of my spine is a little off.
It's more than a little.
Okay.
Okay, I'm just letting you know.
Yeah.
I'm going to explain the mechanics. When you went to a chiropractor or getting any treatment done, were x-rays taken?
Yes.
Okay, you had full spine x-rays?
Yes.
Or pieces?
Full
whole?
Like yeah, like that.
Okay, is it possible to get me a copy of that so we can compare kind of where you were and where you are today?
Yes.
At some
so,
point.
yeah,
It'd be nice to
Yeah.
kind of look at that. I look at the whole person.
Yes.
And things that happen in the foundation affect up above, and vice versa. So let's go over your x-rays, let me explain what I see, then we'll do the exam and go from there.
Cool.
Okay? I'll make sure you understand mechanically what's going on as I see it before I examine you.
Yes.
Ready?
Yes.
This is you, this is a picture in time, tells us how you've evolved from birth. 24 bones in the spine that move, 23 discs in between. This is your 24-story building. This is the foundation of your 24-story building. What you're complaining of is up in the penthouse, okay, on the left side. And we're going to get there, but as you can see, we have a few deviations we need to talk about, okay? This is your side profile, and I'll be going back and forth between both x-rays. This is your side profile. On the side profile, we're looking at a few things. Number one, do we have the right curvature, are the curves going in the right direction? What's the Do we have the right curvature, number one? And number two is posture. Number three is the disc. So first thing we want to do is, what do our curves look like? This should actually be going in a forward direction. You have a perfectly reverse curve. It needs to go perfectly the other way.
Yeah.
Okay? When we look at the overall spine, we don't actually have a lot of curve in the spine. So let's talk about it. When I look here, we should have a little more curve in this low back. Then it should curve like this, then this should curve forward. We say 60, 60, 60. Some of the books now say at least 40 in the neck. All right, so that's number one. We don't have the right spinal curves. What is the consequence of that? That our first line of defense against the forces of gravity are gone. So what happens is the discs start to take up more stress and they start to wear out a little bit faster. Okay? Now, overall though, they're good, but you're still too young to have a disc kind of looking like that. When we're looking at the discs, we're looking at the overall appearance first. They should be level and parallel. And here's what I want to show you. First thing is we can see this one is less, it's angled. The hole is closing a little bit here. This is probably 40% or 30 to 40% reduced already. All of this is because of compensation of not having the curve. It's kind of important what I'm saying. Now, as we go up the spine, let's take a look. You see how we're seeing these circular patterns here?
Yeah.
It's because of this slight curve. Okay, and we're going to talk more about that in detail. So overall, we don't have the curve we need. We want more curve. These discs are all fantastic. These discs are all great. And even though you have the reverse curve going on, your discs are all good. However, you can see this sharp bend here, right? 2, 3, 4, C5. And what will happen over time if you don't work on your neck curve now? It's not just getting adjustment. You got to change a lot of habits.
Mm-hmm.
I'll give you the stuff to do, but you got to do it.
Mm-hmm.
Okay? Otherwise, this will wear out faster. Okay? And then it'll be harder to get that curve back.
Mm-hmm.
Right now, you're young enough. There's enough disc there. We can talk about habit changes to start to redevelop those spinal curves. Okay?
Yeah.
Why that's important is because as we get to the upper cervical here, I know, and when I get here I'll explain, that a lot of your upper cervical is compensating for your mid-back and your foundation. So your jaw is never going to get better unless you fix it all.
Mm-hmm. Yeah.
Okay, just want to be clear about that. Let's talk about this. Let's talk about this building you have here. Right now, if we look at your foundation, we have misalignment of the sacrum and the pelvis. We don't have any leg length discrepancy. However, we have ASIN on the right with the rotated sacrum. Right now, it's 0 MD, meaning your hips are balanced. If I work on your pelvis first, it's going to make it off balance. So that's not where I'm going to start, but I have a feeling I may need to work on your pelvis. And even if we're off 1 or 2 mils, I like to be at 0, but 1 or 2 mils off I'm still okay with, okay? Mm-hmm. As long as it corrects the rotation. Why? The ASIN ilium, if it goes anterior superior like this, it causes the sacrum to go back a little bit, and that causes the straightening of the spine. So if we're trying to bring more curve into the spine, we need to bring this down to let this go forward. Mm-hmm. Okay? But we're not going to start there. We're going to start probably in the sacrum tailbone area. Okay? Now, this is the interesting part. As we work our way up, okay, you have this is 0, this is rotated. The overall effect, if you look at the dot and the line here, is that your pelvis wants to go to the right. Because look, the pelvis goes up 3, turns in. Sacrum goes back 6. The overall effect, it goes to the right. Mm-hmm. But your spine goes the opposite way. So there's a disconnect between your foundation and your lumbar spine. You had stuff happen, whatever it was. Mm-hmm. Okay. Make sense so far?
Yeah.
Okay. Then from here, what happens? The body compensates right there at T11, right? Comes back to neutral. Mm-hmm. And this is based on what's called the righting reflex. We are biped predators. We have our eyes in the front. We have what's called a righting reflex. Righting reflex states the body will do anything to maintain the head straight and eyes level. You know, so you see people kind of like tilting to the side, but they're always going to have their head straight. And that's how these compensatory mechanisms, or that's part of the compensatory mechanism of the spine, or how these compensations happen. From T11 it goes all the way to the right. Yes? You follow me? It's going this way. I mean, it's right there, and the whole thing goes right, 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 and then we have a little kink right here, and then it goes right again. So something happened also here. T1, T2, T3. T4 is a potential, and T4 is actually the cause of your neck. Now watch this. This is really important. Still everything is going to the right, yes? Right, right, yes? But then what happens here? This is tilted on the right, atlas is tilted on the left. Let me put a line there for you. This is your C2, okay? And now this is your C1. So because we have the whole picture, you're telling me left jaw, right? And I see left jaw as the issue, right is compensating. And the way I see that is this, okay? When we're looking at the ramus of the mandible on the x-ray, you can see this part looks thinner, this part looks thicker. Do you see that?
Yeah.
This is the ramus of the mandible there, and this is the ramus of the mandible here. This one is thicker. And the idea is this: when the jaw misaligns, it's going to go, the one that goes down first, it's going to deviate away, okay? Then the compensated side is this. Instead of looking at it like this, it's compensating, so you're seeing it looks thicker. That's what we're seeing there. So your left is the subluxation, the right is the compensation in terms of your jaw. But what I'm trying to show you here, ma'am, is so important. What I'm showing you is all of this is a result of a compensated atlas, which is coming from your foundation. And I had one case recently in the last few months. We don't have a video on it. And this lady had been to 9 or 10 different specialists. And this was what was interesting. We adjusted her sacrum. I'm not saying that's your case. I'm sharing.
Yeah.
Because anything can cause anything. And I've had upper cervical causes of TMJ, true TMJ, T5, T4, whatever. This was a unique one. We adjusted her tailbone S3, S4. The whole right side released and her jaw started to release.
Oh, wow.
From a tailbone adjustment, which made no logical sense.
Yeah.
I'm just, so again, anything can cause, but what I'm showing you overall here, Nicole, is your jaw is all of that is a result of the other stuff. And if you don't work on the other stuff, there's always going to be something there. Okay? I just want to be clear about that.
Yeah.
Make sense?
It does make sense.
You ready?
Yes.
You have questions on the x-ray?
No.
Okay.
Yes. No, I don't have questions.
Okay. Well, whenever you do, you let me know. So we have a T4, but we have a T4 for sure, and I have a foundation. Whatever else I find on you, I deal with. I may work on your jaw today. I may not. It may change by not even touching it. Let's see.
Okay.
Okay?
Yes.
You got it. And along the way, please, Nicole, you're uncomfortable with something, you need a minute, you give me a minute, Doc. The idea is you're here to receive the adjustment, okay?
Yes.
And if there's any tension, nervousness, anything, just talk it through with me, okay? And if something you don't understand or you have questions on what I'm explaining, just ask.
Okay.
All right?
Yes.
Rock and roll. Let's put the blinds up. You know, as I was saying, this is a really unique case because the upper cervical is definitely compensating for lower down. However, long-standing compensations can also be subluxations and have nerve pressure. If there's pressure there, I'll deal with it. The good news is I don't have to adjust it so much. Okay?
Yes.
Come on over. And I'd like you to stand over here. We're gonna watch you walk back and forth a few times.
Okay.
And let's take a look. You've watched my videos, right?
Yes.
You know the walk.
No.
You don't know the walk?
Maybe not.
Alright, so you're gonna walk to the corner of the room and back a few times.
Okay.
We're watching these dimples if they move up and down.
Okay.
You're gonna walk to the corner of the room and back, please. Nope. Keep walking. So she actually hikes up on that left side when she walks. Let's watch this. I want you to watch this. First, this is inflammation and swelling from the tailbone, the sacrum right there. We want to see this move up and down. Go ahead and walk to the corner of the room and back again. So the SI joints don't really move up and down. When you walk, you kind of walk like this.
Mm-hmm.
Kind of shift side to side. Do you feel that?
I do.
Okay, one more time, please. Let's see what we got, starting at the base of the neck. C2, right side, 10 points. Look straight ahead, please. Look up. Let's see if it changes that. 15 points, C2, right side. Oh, we're going to have to deal with it. Doo-doo, doo-doo. That's T7, a little lower. T4 didn't show up, but I'm sure it will in the future. T7, 15 points. I gotta bring these down a bit, okay? Just to there. You see how she sways back, right? This is how she should be sitting. Put a curve in there. This should be your norm. Don't feel so good, right?
Feels, yeah.
Go back to what feels comfortable. Yeah. All right. How long you been singing?
Since I was 7.
7.
Yeah.
What did you used to sing?
When I was 7?
Yeah.
Oh, I was obsessed with Hannah Montana, so I would sing a lot of Hannah Montana.
So you're Miley Cyrus.
Yeah, but I was like classically trained, so different genres.
Classically trained, okay. Yeah. This is down in the low, S5 coccyx. That's where I'm finding it. Classically trained. Static palpation, running our fingers down the spine. And you can see this is all inflammation there, guys. 1, 2, 3, 4, 5, 6, 7, 8 more tender, 9 more tender. 8 more tender, 7 more tender. Which one hurts more?
7.
7 is what I'm feeling there. It starts at 8, but that's squishier. Is it sharper there at 6 or 7?
7.
8, 7. You like your sugar?
Me?
You like your sweets?
Sometimes, yeah.
Yeah, you do. That's the sweet tooth person. More cakes, cookies, and ice cream, or more candy?
No, like pastries, kind of, yeah.
Right there. That's the one. 7, S5 coccyx. And I'm still going to wait on the neck, that C2, after I adjust those two to check, okay? Center on the chair for me, please. Sit back, center, scoot to the right a little bit. And let's check up top. I'm going to just grab a little bit of the hair. You okay there?
Mm-hmm.
Tender on the right, tender on the left.
Left more.
Left. That's the compensation. Okay, let's look at the jaw. Slowly, come on, end face. Slowly open the mouth. Slowly open the jaw. Open, open. Right side deviates first, left side compensates. Do that again. Open, open. Right side deviates, left side compensates. So it's actually left compensation, right subluxation.
Oh, wow.
Right there. So it's actually the right one. You feel that?
Yeah.
So the right is actually the problem. The left has been the compensation all this time. And we will decide if we're going to do, right there is where I'm feeling it, C2. Now I want you to see something. Look, I'm not going to touch here. Just slowly open the jaw. Watch this. Close. Okay, now I'm just going to put my finger on C2, okay? Right there. 1 second. Open. Different?
Yeah, it felt lighter.
Yeah. Now if I push here, open. Not as much change, right?
Yeah.
But when I push here again, C2. So you have an interesting TMJ. This is interesting. It's a good case. So the right deviates out first, then the left compensates, then the right compensates. And that's why on fully opening the jaw, the right one looks thicker, where the left one is the one that should look thicker. Okay, so here's what we're going to do.
Yes.
Oh no, what are we going to do? 1, 2, 3, 4, 5, 6, 7. 7 is a PLS. Oh, this is going to be interesting. You have a right rotated sacrum, but we've got to do the coccyx from the left side. Okay, so we're going to do coccyx to S5 and T7, then we're going to recheck everything, okay? You ready? Let's do it. You're going to go right side down, and we're going to work on the tailbone first. Let's slide that down. Slide down a little bit. I want to make sure your ankle is over the edge of the table, okay? I'm going to be on the outside here. I got to be low though, okay?
Yeah.
Bring your ankle down just a little bit. There you go. Right there. There. Let it roll. Let it roll. Come on up. Stand up and walk it out.
What?
Walk. Keep your head straight, please. Walk it out. Keep walking. A little different when you walk?
Yeah.
A little different, huh?
Yeah.
Yeah. Face down over here, let's get T7. Up a tiny bit more, please. T7 PLS. They see me rolling the Hayden. 7, 1, 3, 4, 5, 6, 7. Get all that tissue out of the way. That's the home run, lady. Beautiful. Not bad. Hold my hand, please. Pretty cool, huh? Walk it up. You're so quiet.
I'm sorry.
You're so quiet.
I can be talking.
I know you're absorbing everything that's happening. And
Yeah.
You're very observant. So I know you're observing all the little things right now. Open your jaw. It's a little different.
A little less tense,
A little,
yeah.
little crazy.
Yeah,
Come,
that's
guys.
weird.
Come check it out. Come check it out. Doing it. Let me see. Slowly open. Come on. That's pretty cool. Let's rescope. Cool. It's a little easier to sit like this.
Yeah.
Yeah. Awesome. You said your show is this weekend, next weekend?
Next weekend.
Okay. Well, we're going to probably regroup on the weekend anyway, right?
Yeah.
And C2 is still there, but look, it went from 15 to like 6. So what does that tell us? This has been reduced more than half by adjusting this. Compensation became subluxation. T7 is clear. Doo-doo. Sacrum is clear. Swelling is down. Swelling is there, but swelling is down. Come back slowly to me, please. L5. S1. Different?
Mm-hmm.
S2. S3. S4. That's the one I adjusted. I'm pushing harder too. Different?
Mm-hmm.
Cool. You ready for more?
Yes.
Let's close your eye in the back. Now, here's a thing, and this she has this classic little finding as well. And the way we're taught in the Gonstead work, you don't really adjust into a reverse curve. There are a few exceptions. C2 is one of those exceptions. If you have significant wedging of C2 on the AP film, even with the reverse curve, we can still justify adjusting the C2. It won't be a lot, but we're going to set it, we will set it today, and we may set it once or twice more. I don't know yet. But that is a very important piece of information, guys. C2. You can adjust it with a reverse curve if there's significant wedging on the AP film, which we have. But typically you don't want to be adjusting into a reverse curve, typically. Usually the bottom or up high. You ready?
Mm-hmm.
Okay. Right hand up. You gotta put a seatbelt on, yo. There we go. And down. There we go. C2. Hands on your lap, please. And C2, we want to come on that bifid, up and set. But what happens with her, that's your C2 right there. You got to laterally flex, right there. You don't want to do more than that. And if I bring her up too much, we lose her C2. So we're going to hold her a little firm there, okay? And we want to lift. Almost. We got it down still. You okay there?
Mm-hmm.
It's tight. Relax the chin. There we go. Drop, drop.
Ooh, yeah.
Clunky. Walk it off twice, please. As you're walking, just tell me if anything is different in the body. We're not at the jaw yet.
I feel taller. I feel like I'm not doing that thing as much.
Let's take a look at the dimples. Hopefully you're walking through them a little bit better. Little bit. Little bit. Keep walking. Do you swing your arms when you walk normally or no?
Yeah.
Okay. Walk one more time. Cool. And have a seat. And let's check up top now. All the way back. Doo-doo. Slowly open. You know that's different, right?
Mm-hmm.
Close. Slowly open. I don't actually want to touch it today. Does it feel better to you? I'll tell you why. Open it. Move it around. Tell me what you feel compared to before.
My teeth feel a little more aligned. There's less popping.
Mm-hmm.
I mean, I know you know, but like it's still,
It's there. That's
but-
not. But that's not the point. It's changing.
Yeah, yeah.
And so I almost don't want to touch it
Yeah.
until our next visit.
Okay.
You okay with that?
Mhm.
Okay, because like I said, this is a very unique case.
Mhm.
And a lot of your stuff that's going on is compensating from the other stuff that happened down below.
Mhm.
And I want to see that things hold
Yeah.
before I touch it.
That
Because
makes
let's
sense.
say, in your case, let's say I adjust it. And I'll do it if you really, really want me to,
Mhm.
but I don't think we should.
Mhm.
If I adjust it, and let's say, oh my God, it feels really good, and then in a day it goes out.
Mhm.
We don't know, was it the neck or was it the jaw?
Mhm. Right.
Make sense?
Yeah.
So if you can bear with the next few days.
Yeah.
You're gonna do lots of icing on the
Okay.
TMJ. Do you want me to work on your septum?
What's wrong with
Your nose is out.
Oh, okay.
I'll give you a nose job today, how's that?
All right.
Look, I show you, I forgot to mention it, sorry. Come here. Look, I show you. This is the right side, left side, right there.
Yeah.
Which is affecting your breathing, which is affecting the voice too. Doesn't the
That's
nose
true.
affect the voice?
It does.
You learned it in class.
That's
Classically trained, you
Yeah.
should know that, right?
Yeah.
Okay, come on over.
It's funny because my mom was talking about my nose this morning. That's why.
On your back. I remember years ago I had a case. There was an older gentleman in his mid-70s, part of a barbershop quartet,
Mhm.
and he couldn't hit certain notes, and it was
Yes.
so crazy. I found a T4 rib on this guy.
Uh-huh.
I adjusted his rib and he got all his notes back. It was wild.
That's what. Yeah.
What?
I've cried a little bit over the past few months
Why?
because I've lost some of like the notes, like singing,
Mm.
and it's like I don't like that.
Well, next visit you're going to show me the notes.
Oh no.
Before and after adjustment.
Okay. That's true.
Deal?
Yes.
All right. Chin down into the table. Chin down, please. There you go. Right there. That's it. You're going to breathe through your mouth, okay? Just breathe through the mouth. Breathe through the mouth. Good. Chin down, please. Chin down. Down, down. Chin down, down.
Oh my God.
Yeah.
That was the $10,000 nose job. You felt that, yes?
Yes. How does that happen?
You had a deviated septum, making sure there's no blood. Dang! I promise you it's going to change.
Yeah.
Your singing changes today.
How does that happen?
Walk it up.
Septum.
Trauma.
Oh,
Slips, falls. You have siblings?
I do have siblings.
Yeah. You guys brawled back in the day?
Maybe.
Maybe. I don't know. Take a deep breath in. Totally different.
Yeah.
Yes. She's smiling.
That feels. That's weird.
By the way, that was probably the second urine tie with another nose crack on my channel. That
Really?
was really, 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 really loud.
That
was
was
it.
really.
They think that the deviated septum adjustment is BS. You're gonna tell us on the next visit, okay?
Okay.
What you're gonna do in the meantime, part of your homework,
Mhm.
come back here and let's recheck
I
this.
can change. Okay.
I got it. Part of your homework is steaming,
Okay.
okay? Lots of steam.
I'm good at that. Yes.
C2 is clear. Awesome. That was crazy deep. All clear. All clear. Sweet! Now, you get a buff and polish. I may even change your genre. Jokes aside, you did really good today, okay?
Yeah.
You did really good today. And this is a good case that I'm glad that you decided to share. And when I went through this process today, we didn't just start cracking a bunch of stuff. Okay, not that we do that anyway,
Right.
but also to show you and everyone else how these compensations can become problems down the road, and why it's so important to get checked, you know.
Yeah.
And she told you to come in Colorado, you didn't come.
I
Stand up.
I should have. I'm
Give me a hard
literally. You
time,
told.
give me a
No,
hard time.
you told me. You were
Squeeze.
like, "Are you ready?" And I was like, "I'm 4 months too late." Yes.
Squeeze.
Yes.
Not shake.
Oh,
squeeze.
Yeah.
Squeeze. Elbow. Relax there.
Okay.
Drop. Wrist. I'm just tuning up what I find. Squeeze. Relax. Straighten it out. Straight. There. Turn. This is for your singing too. Smile.
Oh no.
That's where we're going to start now.
Cool.
Questions?
No. It's probably gonna hurt.
Welcome
Like
to
sore
the-
after.
You'll
Yeah.
have a little sweat.
Yeah.
Welcome to the office.
Thank you.